Come on. Okay, now we're
All right,
recording.
okay.
So just start by introducing yourself. You know, whenever I want to go tight, I remember that rabbis, you have to have their hands in the picture because that's half of how they talk.
Oh, okay. I don't know. I guess
I don't know, do you or not
I
so
do.
much?
I must. I don't even know.
Okay. Just introduce
All right.
yourself.
I am Rabbi Chuck Diamond. People call me Rabbi Chuck. I'm here in the lovely confines right now of Congregation Tree of Life Or L'Simcha in Pittsburgh, Pennsylvania. Couple blocks from the house I grew up in and live in at the present moment.
So tell us about whether it's a Jewish value to care for your body.
It's definitely a Jewish value to care for your body. In recent weeks, we've been reading, as we started the cycle of Torah reading again, we've been reading about the creation and how God created us. We're a gift from God. Our bodies are a gift on loan to us, and we are obliged to take care of them in the best way we can. After a long, long life, when we die, we return our bodies to God, and they should be in the best condition they could be in.
What about age of consent? What does it mean to become adult? Where are some of the avenues to get information for problem solving? And we'll say for the end, when a rabbi should be consulted,
Okay,
unless it
all
just
right.
naturally
Well, age
fits
of
in.
consent. In Judaism, there are different ages. We reach different milestones, and certainly with the age of bar bat mitzvah, we take on certain responsibilities as an adult. Here in Pennsylvania, at the age of 16, we start driving, and that is a huge responsibility that we take on. And then as we get older, and maybe at the age of 18 and perhaps 21, when we get certain more responsibilities, that we have to give our own consent to things. And in order to do so, we have to be as informed as possible.
Kivud v'aim when dealing with health. What if you disagree with your parents on something health related?
Well, honoring our parents is important in anything, and likewise it would be important in health. So I think we have to be sensitive to the feelings of our parents. At the same time, when we reach the age of consent and we're responsible for making our own decisions, I think it's okay to disagree with your parents. But again, I think you need to be fully informed about what you're making a decision about. In this case, your own health. And I think it's okay to disagree with your parents, and hopefully it'll be okay with them too. But it's important to honor them by discussing it with them.
Now, how about your needs as an individual versus the needs of the community? Because this is about vaccination.
Right.
So what about people who are afraid either because the vaccine is painful, or who know that you can find on the internet some people who say vaccinations are actually harmful?
Well, again, it's like the parable of the being in the boat, and two people in the boat, and one starts to drill a hole in the bottom of the boat. And the other person says, "What are you doing?" "We're going to sink." And he says, "I'm just drilling it under my seat. It's not going to impact you." So we have certain responsibilities to ourselves, but we have responsibilities to make those decisions, taking into consideration the needs of our community as well. There are cases where doctors have not given vaccinations to their patients. I believe in California, my sister was telling me about her doctor for her kids, and as a result, there was an epidemic of measles, and people blame him for this epidemic because of the reluctance to give vaccinations. So please, again, it's so important to be well informed on this matter and not go by bubamaises that might be out there.
Does your shul have a policy?
In terms of vaccinations?
Yeah.
No, I don't think so. We adhere to the principles of Judaism, and conservative Judaism. But I've had one case where somebody asked me to write a letter for college that they were not in favor of vaccinations, and I did help them out. But I feel strongly that vaccinations are important to our health, and I would encourage people who would come to me to consider that very seriously.
So tell me more about the person who asked you to write the letter, because he needed you to give him a religious exemption.
Yeah, they needed.
Do you think that's
religious
legitimate?
exemption. It was questionable. I thought it was a gray area. The mother made the case to me, and at the time, I went along with it. But I'm not sure I would make a general practice of that, I have to say.
Okay. what we're going to be covering in part of this curriculum is to tell or not to tell. When does a parent tell a child about being a carrier? And does their child tell friends?
Right. I think that, are you on me? Look like you're off the mic. Okay.
Yeah, I'm getting your hand too.
Okay, all right. See
Yeah.
all the good things I'm saying here.
Yeah.
I would probably lean towards telling to the children, and if you need help to do that, if parents need help, I think there are professionals out there who can help you do that. I think what age? I think as early as possible in terms of them being able to understand it. Now again, I'm not sure I could put an age on that. I'm not sure I'm qualified to do that. But I always lean towards, I think knowing is better. It'd be harder to find out later on, and also what the children would feel like, boy, you knew about this and didn't tell me. So it gives them a chance to grow and mature and to deal with the issues that they have.
Great. Finally, when kids are trying to find sources for information, they have the internet, not quite sure what to believe, what not.
Right.
When would they come to you for advice? And could a person who was not a congregant here, who wanted to
Right.
approach you, come to you, and how would you feel about that?
Right. Well, yes. The answer is...
Start with the question.
Okay. The question is who would you go to for advice? And I think that there are a lot of people you can go to for advice. What I know best is being a rabbi, and people have come to me often about all different kinds of things. And it's the challenge for me is to not talk about things I don't know about, and try to lead people to the right people to talk to if I'm not the right person. However, I do know about Judaism and the laws of Judaism, and I can give advice on ethical types of dilemmas and where Judaism might go. I try not to judge people and try to listen and try to help them to solve their problem. In terms of going, non-congregants come to me, they come to me all the time. And so, yes, anybody's welcome to come to me. As I'm sure that they're welcome to go to any rabbi. I'm sure any rabbi would accept a person who comes in off the street seeking advice. And sometimes it's easy to go to your own rabbi. You know, we say, Oselecha Rav, you should make for yourself a rabbi, and you should feel comfortable going to the rabbi. But sometimes there are questions which you may not be so comfortable with and have to seek some outside opinion. And when people do that, I try to be very sensitive also to the fact that they're coming to me, but they have someone else as their rabbi. So the answer is yes, everybody's welcome. And I would never turn anybody away, although I may say, you might be better off speaking to this professional or that professional.
How do they reach you?
How do they reach me? They can reach me here at the synagogue, Tree of Life for the Simcha. They can reach me, my email, ravchuck@yahoo.com, or call me, 412-335-0298 on my cell phone.
Thank you.